Hi, I'm Lennox McNeary. I'm the CEO and co-founder of ArchiveCore. I am actually a physician by training and work with patients who've had spinal cord injuries, brain injuries, and other traumatic events. And my husband and I actually moved to Roanoke in 2009. Can't believe it's been that long. I grew up in Charlotte and he grew up in Texas, and we both thought this was the most beautiful part of the country and were excited when we both found job opportunities here. And so I've been a practicing physician since I moved to Roanoke. But I actually left my job last summer, it was actually last July, because I wanted to start working on ArchiveCore full time. And ArchiveCore is actually a company that uses blockchain technology to simplify professional credentialing. Most people don't even know what professional credentialing is, but in healthcare, before a physician can start seeing a patient, he or she has to go through this extensive background check process to make sure that they can actually do the things that they claim to be able to do. And they have to get information from about 25 different sources. So as you can imagine, that takes a really, really long time to go through all of that and make sure that they're not missing anything important. It typically takes about 120 days, believe it or not, to actually credential someone. So my partner, Keel Coleman, who is an emergency medicine physician, and I found a way to use blockchain technology to actually create essentially a digital record of a physician's training, the procedures they've completed, and all the other information that needs to be reviewed. So we can cut that process down from months to a matter of weeks. And as you can imagine, it saves hospitals a lot of money. They lose between $5,000 and $7,000 per day in potential revenue, or they're having to pay somebody $1,000 to $4,000 a day extra to cover these shifts when, as you can imagine, in the emergency room right now, they can't just leave those unstaffed. So they're having to get staff to come in and fill them for that extra cost. And it also leads to burnout, and it impacts patient access to care. So we're really excited to have this new technology that can speed up this process and get physicians in place faster. We are a relatively new startup, and as a physician, I have really had a crash course in business over the past year, and I love any opportunity to learn new information. And we have so many experts in this region who understand technology, they understand healthcare, they understand sales and marketing. And these are all things that I need more education in, especially sales and marketing and how we price this as we move into large hospital systems, because that is an animal unto itself, trying to figure out how to approach a hospital system. And so I think that's what I'm looking forward to most out of Ramp.